Today we are going to discuss about our health tests which are required once you turn 50 years old. I am Dr. Shuhini Sengupta and I am the Medical Laboratory Director for Redcliffe Labs. 50 is the time when you are more settled in your life and career. It's also the time when you really need to take care of yourselves. The most important health issues plaguing men and women above the age of 50 are being overweight or obesity, related joint issues, muscle weakness and fatigue, sometimes a little bit of memory loss, also a loss in vitality, some vision changes, and an increased risk of cancer or malignancy, also the increased risk of stroke or cardiovascular diseases. So what are the health tests which are recommended for you once you turn 50? Number 1 is a routine checkup for your blood pressure. Hypertension is a very silent killer. It is therefore very important to get yourselves regularly tested for your blood pressure. Number 2 is vision. Again, an eye test for your vision evaluation is of paramount importance once you turn 50. What are the blood tests which are recommended for you at this age? Number 1 is definitely a blood glucose test and glycosylated hemoglobin as well, which would help to diagnose diabetes if you are suffering from it. Secondly is lipid profile, which would include total cholesterol, triglycerides, LDL and HDL. LDL, as we know, is a bad cholesterol, and it is very important for us to evaluate our lipid profile status in order to prevent strokes and cardiovascular diseases. Number 3 is our evaluation of any underlying risk of malignancy. For men, it is very important to get yourself tested for your risk of prostatic carcinoma. So what test should you go in for? It is a total PSA, that is prostate specific antigen. You can also do a free PSA testing. Secondly, for women, it is important to get yourself tested for HPV DNA as well as PAP Smear for ruling out any possibility of cervical carcinoma. After the age of 50, it is also important to rule out your risk of colorectal cancer. So a colposcopy, rather a colonoscopy, would actually help you in a big way to get an early detection in case you have any possibility of the same. Also, do get yourself tested for any NT-proBNP or HS troponin I or high sensitive troponin T in case you feel any sort of uncomfortable situations or discomfort which could be indicative of an impending cardiovascular event. Finally, do get yourself regularly checked for your joints as well. Bone health is very, very important after you turn 50. So it is important that you get yourself tested for vitamin D as well as other vitamins like vitamin B12, folic acid, along with your CBC, routine liver function tests as well as kidney function tests, which would help you diagnose any underlying liver or kidney disease which you may be suffering from. Wish you all very good health in the new year. Thank you.